Perfect. So I am going to ask our panelists here to go ahead and introduce themselves. I'm going to start with Brandy, who works with Quantum Health. If you could there's Macy. If you could introduce yourself, just talk about where you work and kind of what your role is. And specifically, Quantum Health, could you tell us, what kind of work you guys are doing?
Yeah, definitely. Happy to. My name is Brandy Hinojosa. I'm one of the senior recruiters here at Quantum Health. I primarily recruit for clinical staff, although my role is changing. I'm moving into a new space with university relations, which is very exciting. So we'll be building up that program and, obviously enhancing our internship program and doing those types of things. So I will certainly be, communicating with you all regularly. Quantum as a whole, Quantum Health works in the insurance space. However, we are not insurance providers. So we really help people understand and navigate through their employee benefit plans so that they have a really easy experience understanding what's going on with their healthcare. We have a mix of people that help with that. So we have pods, which are teams of people who help those folks navigate their employee benefit plans. So that's a mixture of nurses who work with like case management and reviewing the plans and helping people understand what's going on there with treatment plans, disease management, et cetera. And then we have our customer service role, which is a patient service representative who really answer and provide that guidance about what the plan covers. Why did I get a bill? How do I find a doctor? Those types of things. So it's really a very full circle, comprehensive, personalized and guided experience through someone's employee benefits. So that's kind of what we do at the heart of things. And then there's also, support staff areas and behind the scenes and HR and IT and all those different pieces. But the front line of the business is really about guiding people through their healthcare experience.
That's awesome. It's something we don't necessarily think of. I think you hear healthcare and we think doctor and nurse.
Exactly. We're on the back end.
Yeah, you guys are doing some really important work. And I think we'll talk about this a little bit later, but you have some roles that students could potentially get into that are entry level, and that can help them to learn about the healthcare field, the kinds of questions that they're hearing and that kind of thing. So definitely can be some great exposure while using their customer service skills and that kind of thing. So
absolutely.
Awesome. Thank you. Yeah. And Monica, if you could go ahead and introduce yourself and tell our students where you work. And I just wanted to point out that Monica is one of our Columbus State alumni. So she was one of our students. She was in your place to start her career. So we are really happy to have her here.
Good morning. Oh, no, it's not morning to you. I'm sorry. Good afternoon to you all. I'm in Los Angeles. I thought, make sure that you say that correctly. So good afternoon. I am Monica Goodwin. I work at Children's Hospital Los Angeles. So there's a 3-hour time difference for me. But I am an alumni and was super excited to hear about this. I plopped it on my calendar the minute I saw it because I thought that it was really important to be a part of this. I'm the director of the emergency services at this hospital. We are the only pediatric safety net hospital, and that means that we provide services to most of our patients are people that either can't afford regular insurance, so the insurance that your employer might provide, or they have hit just some hard times and they're unable to have the type of insurance that an employer would offer. The other reason why we would consider ourselves to be a safety net is because there are certain patients that are needing medical services their entire lives. And so when that happens, even if you're receiving insurance from your employer, frequently families will use government insurance to supplement the care for their children. And so we are that hospital in Los Angeles County. We serve about 10,000 patients a month. In the emergency department. We are a busy facility. We are responsible for, we also have a helipad, so we're also responsible for picking up patients outside of LA County should they need pediatric services. We are the only level 1 trauma center in LA County for children. In California and Los Angeles, adult facilities also see children and have units for children, but in this particular hospital, that is all we do is children. I'm responsible for hiring the leadership team as well as the frontline staff. In this emergency department, we use techs, and we were just talking about students in those roles. I'm sure most of you are not willing to relocate, but if you are, let me know. We were talking about how we want to make sure there's a percentage of our techs that are students. And so we just developed that just yesterday, that we were going to use 40% of our techs and hope that we can keep them as nurses. And then we'll use the other 60% for people who want to actually be in that position for a while. So I hired those positions. Also, we have a new grad residency program. And so we do that. And then we hire registered nurses. So I feel like I am evidence of what Columbus State can provide. When I think about what I've done in my career, I'm reminded of the book, Oh, the Places You Will Go, because I feel like I've done a lot with that degree. Thank you.
Yes, absolutely. And this week has been pretty good, but last week was very rainy. So I think maybe your offer to relocate could be enticing to some of our students. Thank you for being here. And then we have Macy joining us from Nationwide Children's Hospital. So if you could introduce yourself. Macy is in a talent acquisition role. If you could just introduce yourself to our students and tell them a little bit about what you do.
Absolutely. So like you said, I am a talent acquisition partner, and I get to hire in all I work with the whole team, but our nurses here at Children's, PCAs, unit coordinators. So you were talking about those entry-level roles along with the career path of, I just graduated with my LPN. We can hire you for this role, and vice versa on the employment team. We do have entry-level roles there as well. So that is a little bit of what I do. We love seeing students apply to those entry-level positions because we do have multiple career ladders that you could potentially take, because when you are in that role, you will see different healthcare professionals and you will think like, oh, I had no idea, they need these people at a hospital. So
Absolutely. We work with our alumni quite a bit. And one thing, the biggest piece of advice that they give to our current students over and over again is get experience as soon as you can, like get exposure to the kind of environment that you want to be working in, which I think can be really helpful. Let's jump into some questions. Our students submitted some great questions. I've shared some of those with you, and more can come in the chat. So another reminder for our students, if you want to add anything else or you have follow-up questions, let us know. But I want to ask you guys, and I'll kind of call on you to answer. If there's anything that you really want to answer, feel free to jump in as well. But I wanted to ask, what are some of the qualities that you are all looking for when you hire candidates, especially thinking about like our transferable skills that are kind of our entry-level positions might have? And I'm going to go ahead and ask that question first to Brandy.
Sure. So for us, I think the biggest question that we get people coming in is, I don't know anything about healthcare or insurance. And that's okay. Mm-hmm. We have a very thorough training program that, is probably like a survey course at Columbus State. It's that intense over 6 weeks, where you're really learning all of the ins and outs of insurance and how all of those pieces work, how our systems work. So rest assured, the experience isn't something that's particularly necessary for that. But what we're looking for is that someone who cares. For Quantum, it's definitely a space where we want our members to know that they're valued and that we've got their back, essentially. So it's someone who's passionate about helping others and someone who's passionate about making an impact in someone's life. Those are the types of things that we're looking for. Do you need to be a little tech savvy? Sure. You got to be able to navigate the systems. You got to be on the phone, typing and doing all the things. So there's those pieces, and we can teach you some of those technical aspects of the systems, but really it's who you are at your core is something that we're looking for. Someone that's really aligned with our values and someone that wants to make a difference, I think, is a big piece of what we're looking at.
Absolutely. So definitely some of those are skills that we might have naturally. Those are skills
Mhm.
that we might develop through if we've worked retail or if we've worked,
Yeah.
food service or those kinds of jobs. And
Yeah, I was just going to say, we definitely find a lot of success for folks coming out of hospitality space. So, restaurants, hotels, any service related industry definitely translates really well at Quantum.
yeah, we love that. And those are a lot of the jobs that our students might have currently. And so thinking about how those skills could transfer for sure. And Macy, you had mentioned some entry level kinds of positions. What kinds of skills would you say that Nationwide Children's is looking for when they're hiring for some of those?
I would definitely say customer service and just like Brandy said, somebody who is just kind to their core, because you will be dealing with patients and family members. They could be having a rough day, and you're the first person they see. So, and that is what we definitely look for. Also, to just being adaptable, accepting the change, because every day is not going to be the same. So those are some main things that we do look for.
Absolutely. I think, especially this past year, flexibility, adaptability has been an extremely necessary skill for all of us. So definitely, and I think our students have learned that as well with their distance learning. So that's great. And then, Monica, you are in more of like the clinical side of things. Are there certain kinds of skills or like backgrounds that you look for entry level roles?
Yeah, for those people that are on the call that are in nursing school currently, you will appreciate this. And for those of you who aren't and thinking about it, this will make sense to you later when you choose it. We learn in nursing school that there needs to be evidence behind everything that we say. And so we use the term as evidenced by. And so when we are interviewing, I'm constantly looking for evidence of. So evidence of your compassion. So it's not enough to just say I'm compassionate. It's not enough to just say I'm kind. Bring your evidence to your interviews to support that which you believe you are. So if you feel like it's not about what you've done in the past necessarily, it's about the evidence. So when you're thinking about what organizations want, if they want kindness, how are you kind? Can I have an example of that? I'm constantly looking for people who are team oriented, compassionate to their core. Those are things that cannot be taught. You just are those things. And so I'm not looking for anything that I can't teach. I'm looking for the things that I can't teach. I can teach your skills. So if you don't have any skills, I don't mind that. If you don't know where things are located, I can teach that. I cannot teach kindness. I cannot teach compassion. I cannot teach your ability to understand your impact on others. And so those are the things that I'm constantly looking for and the evidence of those.
Yeah, and that's really interesting, and I hope our students are paying attention, because we have Brandy, who's kind of on like the back end of things and in the insurance realm, and then we have Monica, who's in kind of a very traditional like clinical healthcare setting that we might think of. And you both said the same thing. It's really about like who you are and how kind and compassionate you are, and that is something that we can't teach. And I love the advice to show evidence. We definitely see that. I work with our graduating nurses, and they definitely demonstrate that with their resumes, and that's a big thing that we talk about. That's a big thing that we talk about as career counselors. When we're helping students with resumes, we say, like, don't just tell someone what you can do, but give an example, like show them, be able to provide that information. So absolutely. And we have a question. This is from the chat, and I'm going to specifically ask this to Macy. Someone said, how do we find recruiters, or how do we connect with people who are doing hiring? So they specifically are asking, like, how would I get in contact if I had questions about a position?
Absolutely. So in our case, you can always go on our website and email the general HR email, and then they will usually direct it towards us. Or also, we have gone into putting all of our information out there, like Macy recruits for RN care coordinators. And if you have any questions about that, please contact Macy. And it lists all of our recruiters. But since our team has changed a little bit, I'm not sure as much how that's updated, but I would just suggest going on to the site and finding just a general HR email, phone number, reaching out to them, saying why you're contacting them, and then see if you can get any response there. Usually they are really responsive and will get back to you.
Absolutely. And another thing too that I can say is that at Columbus State, our healthcare programs are very engaged with employers. And a lot of times they will do events kind of like this, or they might do a job fair, or they will typically create opportunities to connect that a normal job seeker may not. And one thing I saw as far as Quantum Health goes, you guys do some like open houses and open interviews, right? So you can actually meet the people that are doing some of that hiring. Absolutely. And Brandy mentioned in the chat, you may also want to check on LinkedIn. We have to do some networking. You always hear it's more about like who you know than, what you know. And a LinkedIn profile can really help you to connect with people who are doing hiring and who are working in the field that you want to be into. So Monica seconds that. LinkedIn. We're all going to go and make LinkedIn profiles after this. So, all right, so we do have some more questions coming in. I'm holding on to those, just know that I see those. But I wanted to ask, what do you all look for on a resume? Are there parts of a resume that you find most impactful? And Brandy, could you let us know kind of what you're looking for if someone applies?
Sure. So, I think we're looking for a resume that's clean and easy to read. You hear all the stats about recruiters, take 10 to 30 seconds to review a resume, and it's true. And we're looking for key things to jump out of us. We want to make sure that you're really highlighting achievements versus a job description. So not so much that, I took calls every day to what those numbers look like. What were your metrics? What kind of impact did you make? So you want to be able to share your successes in the roles versus just a list of this is what I did every day, because we know what you did every day, but we want to know how you really impacted what was happening there. So I would say just make sure it's clean, nice, and not muddled up with a lot of pictures and different fun graphics or different fonts and things like that. Basic is good when it comes to resumes. And as far as clinical folks too, and I know we're going to have some new folks that are coming out, when I'm looking at clinical resumes, especially for someone, we hire for clinicians that have been in the field for at minimum 2 years. So you need to go out and get some direct care experience, and then you can come to Quantum when you're ready to step away from bedside. But I see resumes for nurses coming through that still have all of their clinical experience from when they were in school. If you've been out in the field for a few years, there's really no reason to have all of that still on there. It just kind of junks up your resume, and then it's hard for us to really distinguish where you've been working and what you've been doing because you see all this extra stuff. So I would just be clear and concise is really the kind of things that I'm after. Make it easy.
Absolutely. Definitely making the information easy to find. And again, like you said, showing accomplishments. I think a lot of times people kind of treat their resumes as another job description. And, really being able to show what you've contributed can be really helpful. Macy, what are your thoughts? What are some things that you look for on a resume?
I also look for organization, clean, concise, neat. Also, I look for how long you've been in a job. If you're just job hopping every 3 months, that doesn't look good. If you are a student and haven't, held a job, that's okay too. It's just be expected to answer that question in the interview. Definitely, if you haven't had a job and if you are volunteering, put that down on your resume. So when you are asked about it, you can definitely highlight great things you did during your volunteer experience. But those are the things I would add, because I definitely agree with Brandy with all those things that we do look for.
Absolutely. And we get that question a lot from students. Like, if I don't have work experience yet, what do I put? So those are really helpful tips. And Monica, what are your thoughts on that? What are some things that you look for on a resume?
Yeah, as I was listening to Macy and Brandy, I was thinking, yes, those things. And I was also thinking, unless you are a second degree student or you've had a previous profession, one page is plenty. So you don't have to make up things. You don't have to tell me how you worked at Target and then Walmart and then JCP. Like, I don't need all that. Just show me that you have some customer service, 2 jobs, 3 at the most, if they don't have anything to do with nursing, and then show your impact on that, and how you can transfer the skills that you learned there into the job that you're wanting. But please don't make it more than one page if you haven't had a previous profession, because it's not going to get read, and that's really the truth.
Absolutely. So we hear students too say that, like, I feel like I did the same thing at every one of my jobs. So, being able to be concise about that and summarize that efficiently is important for sure. And then we have some students, we have some international students in our population. I don't know if any of you can jump in on this one. Any of you have experience hiring international students after graduation? Is there any specific advice that you might have for them?
Do, but the only things that I know on my end is that any work visas or anything that needs to take place on the back end happens in HR. When you are interviewing, the person that is interviewing you does not have knowledge of that. And so you should come to that interview with just your presence and what you bring for that role, because that person is not going to it muddies the water if you start talking about that, because they're not going to help you with that. So just keep that in mind and work with your actual recruiter on that part, not the person who you will be working with, because they don't know anything about that.
Yeah, I would agree. And just to piggyback off that, from the recruiter perspective on our applications, we have a question, do you require sponsorship now or in the future type of thing? And I would say be honest there. For our organization, unfortunately, we don't do sponsorship. We're just not at that level where we're able to do that at this point. So I would say be honest there, because we've had that happen where people mark, no, I don't need any sponsorship assistance. And then we go through the whole thing. And of course, we want to hire you. And then we're at this point where, oh gosh, now we're not able to move forward. So I would just, be aware that not all companies are able to provide sponsorship if that's something that you may require.
Absolutely. And one thing I would say too, one thing that we noticed this specifically in student employment at Columbus State, we see this, make sure that you're thoroughly reading those questions as you're going through your application. We sometimes will see people either eliminated or like Brandy said, kind of move further along in the process that, even though they might have some restrictions because of the way they answer those questions. So I would say really read those and make sure that you understand them. And if you have questions about what does this mean? What are you asking me? Like, what information do I need to provide? I would recommend reaching out to HR and just asking those questions ahead of time. It will save everybody time. So that's a great question.
Chelsea, I would say that that's not even just targeted to just international students. I would say that's anyone applying for a job. Yes. Is really pay attention, read carefully.
Absolutely. Read those questions. And definitely ask questions first. I think if there's something that's not clear, ask the question first. And that way we have students that will sometimes be eliminated from jobs and not really understand why. And it's because, maybe they misunderstood a screening question or something like that. So absolutely. So next question is, what should I know about a company before I apply? And Macy, can you speak to that a little bit? Are there things that Nationwide Children's looks for?
Yeah, so we just look for if you have experience with kids. If you don't, it's okay. We just want to know if you enjoy working with kids. So really any experience of like nannying and babysitting. I know there is like an app now you can sign up to babysit, kind of things like that. And also it's not a bad idea to research the company. Spitting out, facts during an interview will leave a great impression on the recruiter, and they will never forget. You, because they will be very impressed that you gave a fact from the website, or know our mission and our values. So that is kind of what would have a candidate stand out in an interview.
Absolutely. And Monica, what are your thoughts on that? What do you think that our students should know about a company before applying?
I think it's really important to identify what avenue you are interviewing. So if you're doing an open house, just really quick information that you would know about the organization. Who are you serving? What are kind of some of the hot things that they're working on in that organization? Perhaps if there's some form of ranking, maybe what they're ranked, but just really high level information, because when you're doing an open house, they're going to see lots of people, and sharing all the things that you know about that organization is sucking up the time that it takes for you to talk about you. So really think about the avenue in which you're interviewing. If it's an appointment and it's like 2 to 2:30, then absolutely share what you know, but just be mindful of the avenue in which you're interviewing.
That makes a lot of sense. And, just thinking about how much time you have and kind of what you hope to accomplish in that time can be really helpful. But especially if you do have the time, showing that you know something about the company can be good. And I like that Macy mentioned that that's what's memorable in a good way. We want to be memorable in good ways at an interview. And Brandy, do you have any thoughts on that? Or is there anything else you can think of that, our students should know?
Yeah, no, I think, everything mentioned is good. You definitely want to do some research, bring that in for Quantum, the attempt to present what you know, but we ask everyone, what do you know about us? And really being able to identify, like you said, with mission and values and goals. I think I've been stumped once by a question for someone asked me from the amount of research that they've done about the organization, which was fantastic. I'd love for it to be kind of challenged in that way, to show that someone really is digging in to learn more about Quantum, because we serve such a great purpose that we want to make sure people are really understanding what that is. So I think doing your research, doing your homework, questioning things is not off the table. I've had people ask me like, hey, I saw this review. What's your take on that? That kind of thing. So it's fair to ask those questions. And I think, to Macy's point, the recruiter will be impressed by that, because you did do your homework and it shows that you're invested in it. And that's what I want to see, your genuine interest in the organization, and that you took the time to do that.
Yeah, I'm sure probably all of you can attest to seeing candidates show up to interviews not knowing anything about the company. That probably becomes clear very quickly. And so, yes, we want to be memorable in a good way and kind of show that we've done our homework. And that kind of leads into my next question, which is all of our students are kind of just getting in the door to healthcare. They're just, like I said, we titled the event, Getting Your Foot in the Door in Healthcare. I'm wondering if each of you could speak to some entry-level positions that your organization offers. And I'm going to start with Brandy, because she has some interesting opportunities that I think our students may not necessarily think of. So what are some positions that our students could be looking at applying to while they're still in school?
Yeah, so our patient service representative, or you may see it listed on our website as a care coordinator, that's our entry-level role at Quantum. It's a great place to get your feet wet in the healthcare industry and kind of learn a little bit more about what's going on. It's customer service-based role, telephonic in nature. And while most people equate it to like a call center job, I can tell you right now, while there are aspects of that certainly translate, Quantum is far from a call center. It doesn't really operate in that traditional sense. The goals are definitely very different. We have open interviews every Wednesday from 3 to 6 if you wanted to stop by. All positions right now are full-time, but we do some later shifts and, after training. So there's definitely an option, and they're piloting a part-time program right now, which we're really excited about. So once we see how all of that works out, hopefully we'll have more part-time opportunities available, so that way we can really coincide with school schedules and work best with that. But I think our patient service representative care coordinator is certainly the kind of focus role right now.
Absolutely. And one thing too, we actually do have a lot of students who work full-time while they're in school. It's nice to have an employer that can be flexible with some of the scheduling and things like that. We actually have quite a few students who have been in those the patient service representative roles with you guys. So we've had a few, and everyone has such good things to say about it. They're learning so much. So it's definitely something that we hear, and we love to hear that. So awesome. And so Monica, could you talk to, what are some entry level roles that our students might want to consider?
I frequently hear students who are looking for the PCA role, but everyone is looking for the PCA role, right? So stop looking for the PCA role. I highly recommend that you look for some of the other roles that people aren't thinking about. And now that I say this, everybody will be thinking about it. But there's patient transport, there's the cafeteria. In my hospital, there's valet parking. Like, there are a ton of other positions that may not be clinical in nature, but you are going to be seeing and serving clinical people all day long. There's so many times when I interact with, even in environmental services, I will interact with someone and they'll say to me, I'm in nursing school. And I'm like, oh, you are going to be an amazing nurse. The way that you serve in that capacity in the job that you have now says to me you are a good steward of whatever you do. And so I highly recommend that you look for just entry-level positions, just period, in a hospital, not necessarily the PCA role, because there are ways to move into nursing even after that. You don't have to have a PCA role.
Yeah, that's really important. And I think I heard Macy mention this earlier, that it gives you exposure to what jobs are out there, right? And I know Macy and Monica work in very similar organizations, but Macy, do you have anything to add to that? Are there any entry-level roles that you might recommend?
Yeah, so there's a clinical side and there is a non-clinical side. It really can be different in that way of like information desk, patient transport, materials transport, nutrition services, housekeeping. That is really more of the non-clinical, but clinical, obviously the PCA, unit coordinator. We also have human milk techs. What they are is they are the people in the NICUs who fortify the breast milk and the formula for babies in the NICU. Not a lot of people really know about that job because they see human milk tech. What is that? So as soon as I'm sure I mentioned NICU, everyone kind of, if they love babies, that's kind of what they shoot for. But that is more of a clinical entry level, is those three.
Absolutely. So there's a pretty wide variety of positions to gain exposure to this field. So and it looks like Ty asked a really great question in the chat, and Brandy is already on top of it. So absolutely. He's asking, how do I ask for feedback if I get a rejection? And that can be hard. I know it's not always necessarily shared. A lot of times we're using systems where they kind of get an automated message of, we went in a different direction. And Brandy's advice was to check in with the recruiter, check in with HR, and they're likely to be able to give you some valuable feedback. But one piece that I love that you mentioned, Brandy, was be open to it. It doesn't feel great. When we get a rejection,
be open to that feedback. I get a lot of people that get really combative really quickly sometimes if I'm giving them feedback, or they're like, I just don't understand. And, not every job is for every person, and not every person is for every job. That's my motto. So it might not be the right fit for you at this time. I've certainly had that happen where it wasn't right at the time, but a year later it was great and it worked out well, so I would just be open to it and just take it in and use that as a lesson for the next go around.
Absolutely. it doesn't feel good to get that rejection. And, it doesn't feel good to feel like we somehow made a mistake or we just didn't do well enough. But, looking at that as an opportunity to grow for sure and just do better the next time. Absolutely. So next question. Yeah, Monica has some good tips as well. So thank you guys for contributing to the chat as well. Next question is, what are some common mistakes that you see job seekers make? Are there common things that we want our students to keep in mind? And Monica, are there things that you commonly see that are just like, you just want our students to know not to do these things?
Oh, so many things. I would start with errors on your resume. Ty, when you're talking about how do you know, when it's an automated rejection, I stand by sometimes, and most of the time it's just there were more qualified candidates. But one of the biggest things is errors on your resume. It says that there's no attention to detail and that you also don't ask for help. Because someone else should be looking at your resume to see if they notice anything. You are not going to notice your own mistakes. So please ask someone else to do it. The other thing is, I know that we have moved into a more casual culture just overall, but when you show up for your interview, the very first thing that they see is your presentation. And while we should definitely be in a culture where your heart matters, I don't see your heart at first. I see what you have on. And so that matters. Show up as if you want the job. Don't show up wrinkled. Don't show up with fishnet pantyhose. Don't show up where I can see any form of your undergarments. I've seen all kinds of things. You are advertising you. Be your best advocate by showing up as if you want the job.
Yeah, and I'm going to do a little plug here for career services, and Taylor did this in the chat. So first of all, we can help with your resume. So come see us. We want to look at it first. We can help. But we have an event next week with Dress for Success. So if you have questions about like what to wear to an interview, what does a business casual vibe look like versus professional, come to that, register, and we can talk about that then. Yeah, so those are great. Those are absolutely great points. You're right. Sometimes when you're looking at a document yourself for so long, it looks great, myself included. I'm like, this looks awesome. And then if I take a break and come back to it, I notice that there might be some mistakes. So definitely reach out for help there. So Brandy, are there things that you feel like are common mistakes that you see?
Yeah, there's a couple things. One that I see far too often, unfortunately. Yes, the errors on resumes and things like that, but I would also say the error in who you're addressing on your resume or cover letter. I get things for the wrong business. So they're just blanketing the same thing over and over and over again with every application. You want to take the time to adjust that. You might not be rewriting your resume entirely for every position, but at least make sure it says, wanting to obtain a job with children's when it's coming to quantum, so you want to make sure you got the right business on there, first of all. The other thing I would say to really be mindful of is when you are speaking with recruiters or interviewing in general, answer the question you are asked. Many times I just ask a very simple intro question. How did you hear about us? And next thing I know, we're on a 20-minute tirade about your whole entire work history and this, that, and the other, but you've not even answered how you heard about us. So just be mindful. I know you want to get it all out there and it's excitement and sometimes nerves get the best of you, but take a minute, really listen to what was asked and then answer. That's probably the biggest thing.
Yeah, that's absolutely a great point. And just so our students know, in career services, we also do interview practice appointments. So we would rather you work that out with us than work that out with Brandy and Monica and Macy. We're going to practice ahead of time so that way you feel like you can put your best foot forward. And so Macy, are there anything that stands out to you that you would want our students to know, like common mistakes?
Yeah, just again, double checking your resume. I have seen multiple resumes of the resume template instead of them inputting all their information. I also have gotten a picture of somebody's feet when they submitted an application. Same with like a selfie. So just make sure that you are, double checking before you are submitting your resume. like Brandy said, if you like, just a tip that I always tell students, because I know, and we all know, you're not just applying for one job at one place. Just save it like Macy Children's resume, or Macy Quantum resume, or Quantum resume, Children's resume. So you are aware, and that is just the last step of, oh, am I submitting the right resume? And you can double check, and when you save it that way. That's some advice I always give students, because we all know you have to have you're looking at multiple places. So hopefully that helps.
Yeah, I'm sure you guys get all kinds of attachments to things. I've definitely gotten students English papers instead of their resume before, some things like that. So yeah, just being really detail oriented. And I know, especially if you feel like I need a job yesterday, it can feel like pressure. So we're kind of like really trying to do as much as we can. And so, but really we need to pay attention to those things. So absolutely. And that rolls into our next question. And you may have different answers for this depending on your organizations. But I have students ask a lot, is it bad to apply for multiple jobs at the same company? And so what are your thoughts on that? And I'll ask Monica first.
So I can't answer that. Actually, I probably is a Macy question, to be honest. So as a person that hires down the line, so like Macy is the first person who probably sees resumes, or someone on their team. I don't know that you've created 10 resumes unless they tell me, or that you've applied to 10 positions. I have no way of knowing that. And so from my perspective, just you can leave that out in the interview. If the recruiter wants me to know that, they'll tell me. If they see evidence of something that is bothersome to them, that is an internal process that we need to work through. But from an interviewer's perspective, I have no way of knowing that. I don't see that you applied to 10 other positions.
And that's a great point to make, is that, kind of what the process looks like. So absolutely. So kind of our end stage hiring managers may not have access to that information. And so let's jump over to Macy. What are your thoughts when you see kind of that first round of applications? Is it a problem if students are applying to multiple jobs?
So it's only a problem if you're applying to multiple jobs, if you keep interviewing and not getting a job, and you just keep applying. And if you're receiving the feedback and you're still not being selected, that is when we would have a conversation with you. I know somebody will reach out to you, be like, hey, I see you applied to 60 jobs. This is why you're not being selected. Or I always suggest that nursing students who are about to graduate apply to their top 3 nursing roles that they really see themselves working in. And then from there, if they haven't heard or been selected, then we tell them to reach out to us to see why they aren't being selected. We'll go deeper into that. But yes, we do see how many jobs you apply to. And it is only a concern if, like I said before, if you're interviewing and you're just not being selected for different reasons. But I will say there is somebody who had just went crazy and applied to 200 jobs. And so from there, we had a conversation, and we were able to get down to that problem and fix it. So again, keep it to about 5 or 6 positions if it is non-nursing roles. And then from there, if you aren't being selected, for sure, reach out to somebody to get some feedback in that sense.
Yeah, that's a great point. And that's really nice to hear that you're paying attention to that, and being proactive about doing that, that outreach to candidates. So that's definitely really helpful. Brandy, what are your thoughts?
Yeah, so I think yes and no. I think it's definitely okay, from our perspective, to apply to different positions. I would just make sure you're applying to positions, that you're qualified for. So I've had this happen in the past where I have someone who has very little work experience, new to the workforce. They apply for the customer service role. They apply for a nursing position. They apply for a director level role. pay attention to what you're applying for, because quite frankly, that person is now off my radar. If you can't even read the job descriptions, if they're just blanketly applying to whatever they see, it just shows me that you're not really invested in it and you're not really taking the time to look at it. So I would make sure if you are applying to multiple things, that's great. I would just make sure that you are qualified for each of those roles.
Absolutely. Yeah, Monica.
I just want to piggyback on something Macy said. Macy talked about choosing your top 3 roles or positions that you're excited about. I do want to make sure that I say to the people that are on the call that nursing tells you what you're going to do initially. As much as you say to yourself, I'm going to be an OB nurse, don't pigeonhole yourself there. Nursing tells you what you will do initially. Now, that doesn't mean that your second job won't be an OB nurse, but it is really important that you remain open to your top 3 positions, not necessarily this is what I'm going to do and this is only what I'm going to do. So I would ask that you really listen to what Macy had to say. It's 3 things, not 1.
Yeah. And what we are seeing, and I think you mentioned this, Monica, that you do this at your hospital as well, but what we are seeing is that a lot of our local hospital systems are doing fellowships for our brand new nurses that really kind of expose them to a variety of areas, or at least a variety of experiences within an area. And so absolutely, definitely be open. But I think Macy's advice to have a top 3 is really helpful. Then you have some direction, but you're also open to the opportunities that are available to you. So that's really helpful. Next question. We had a lot of students submit this question. This is probably our most asked question, which I love. But how should our students be preparing for interviews? What are some things that you might recommend to them? And I will ask Brandy, how would you recommend that our students prepare?
Sure. I would make sure a couple things. Make sure that you're researching the organization like we've talked about. Make sure you're clearly, review that job description so you understand what's going on about that role so you can ask appropriate questions like, hey, I saw that the job description mentions XYZ. How does that incorporate into my day-to-day? Blah, blah, blah. Be able to ask some really great follow-up questions instead of getting to the end of the interview and saying, oh, I'm good. I know there's more things going on there and you want to know about those things and ask the questions. It's okay. I would also say take advantage of career services. I'll give you a plug. Practice, because, like we were saying earlier, sometimes you just get so excited or pent up and wanting to just get it all out there that you're just like, but, here's everything I know. Take the time to practice questions, stand in front of the mirror, talk with a friend. It's okay. I know it sounds silly to stand in front of the mirror and practice responding, but it's going to help you in the long term if you can start really understanding how you're verbalizing and responding to questions and think about things you may be asked. You're going to get the situational type of questions, tell me about a time when type of questions. So have those things ready to go. And don't be afraid, especially if it's in person, you can bring notes with you. I respect that 100%. If you have those kind of just things to remind you as you're going on, because sometimes you're going to forget in the moment. And if you have a little keyword that says, oh yeah, that's my example for this, do that.
Absolutely. And it looks like everybody's kind of nodding along with that. Macy, what are your thoughts? How should our students prepare for interviews?
Definitely bringing the most updated copy they have of their resume, error-free, grammar-free. Definitely piggybacking off of what Brandy said, everything she said. Also, I know everything is virtual or over the phone, majority of it. Just a tip is that if it is over the phone or virtual, I would stand up because that way your voice projects and you seem more confident when you are talking. That is also one tip I give students who, it is their first interview and they do seem nervous. Also, like Bree said, practice questions. You can even Google interview examples. For sure, know your strengths and weaknesses. It's not terrible that you have weaknesses, but we look for that you're actively working on them to get better, and how this position will help you get better in those areas. So those are some tips.
Absolutely. And Julie, mentioned in the chat some of the services that we can help with. So students can practice with us. I actually did 2 practice interviews this morning before we jumped into this session, so we can help you with that. And yeah, definitely just thinking of examples, examples that show your results, your contributions to your employer. So I think definitely that can be really helpful. Monica, do you have any other thoughts about how our students can prepare for interviews?
The only thing I was going to talk about, I agree with both what Brandy said and Macy. I was just going to add the nervousness piece. I have seen people come and they are so nervous that they really can't articulate their message to the person who is trying to hear that. And so it is really critical, number one, that you are practicing, that you are learning some breathing techniques. I know that that sounds strange, but it is the only way that you're going to be able to combat that nervousness. And there's certainly an element of grace that is provided for nervousness, but you do still have to be able to articulate your message. And that's only going to come from practicing. I really appreciate authenticity when I'm interviewing people. So if they speak to that right in the beginning, we can address that and get it out of the way so we can move forward. But then once we move it out of the way, you've got to do your part. So I really practice.
Yeah, and we talk about this a lot in career services. Obviously, we're doing the practice with students, and I think a lot of times people have a misconception that people are just naturally good or bad interviewers. And it's just a learned and practiced skill that none of us practice. We don't practice until we actually have a job interview. And so I try to kind of remind students that. And one other thing that I try to remind them, and hopefully you all agree with this too, but the person interviewing you, first of all, you wouldn't be at the interview if they didn't think you could, do the job. But also it makes your guys' lives easier if you want to like them, if you want them to be a good candidate, and a lot of times I think our students sometimes feel like interviews are a little bit more of an interrogation than a conversation. But just kind of going in and realizing that that's what it is. It's a conversation. So you guys can really get to know them. So absolutely. And we are almost out of time here. We have about 5 more minutes. So I want to encourage our students to leave any last minute questions in the chat if you have them. But I wanted to ask the question, what are some ways that your guys' organizations support new employees? As well as we got a lot of questions submitted about how organizations are supporting diversity. So those kind of go hand in hand as far as things our students should be knowing. So could you guys speak to that? And Macy, I will ask you some ways that you're supporting new employees and especially supporting like a diverse workforce.
Absolutely. So we have ERGs, and they are for the whole hospital. So their ERG stands for Employee Resource Group. And so really it covers all different types of diversities, new employees, diverse groups. And we really love to support and advocate for all those groups. We have meetings. So if you want to join like 5 groups, great. If you want to join 1 that really speaks to you, awesome. But we really love to see our employees really engage. I know we do all different types. We go and have booths at all different types of like career fairs or events to really get the word out there. And then really how we support new employees is, I know each manager in their unit has like something different, but we really celebrate the 30-day mark, the 90-day mark. We really check in to see, how are you doing? Do you like this job? What do you like about this job? What could you change? And we really connect that way on a personal level to see if there is something concerning or if something we need to change, or you just love it. But that is a couple of ways.
Absolutely. Brandy, what are your thoughts on that? I know you had mentioned you guys have a pretty extensive training program, right? So you speak to that.
Sure. So when everybody comes in, we have a 6-week training program 3 weeks classroom, and we do tests. So it's almost like a class, like I was talking about. So we do 3 weeks classroom, you take like a midterm, and then you got to pass your midterm. And then you take the cultivation section where it's the live environment. So you really get a chance to practice with coaches and mentors and trainers with you the whole time. And then you take your final. So midterm and final, got to pass that. And then you get out to the pod where you're then supported by your team leads and the managers. We also have ambassadors for everyone that comes to the organization. So you have your own ambassador, which is not necessarily like a specific professional type, but just someone that's kind of there, your friend that's going to help you along your answer questions and help you get acclimated to Quantum and tour around the building and all of that stuff. We also have ERGs at Quantum. I'm actually the chair of Quantum Unidos, which is our Latinx group, but we have groups for everybody. And same thing, you can join one or all or none, whatever speaks to you. They're all inclusive. It's nothing's exclusive or need to be of a certain, background to join those. We have Quantum Unidos, we have Quantum Black Voices, Quantum Veterans Military Group. We have Warrior Pride, which is our LGBTQIA plus group. We also have Aspire, which is our Asian American Pacific Islander group. I think I hit all of them. But yes, here it's definitely a big piece of who we are. We want everyone to feel that they belong, that they're included. So diversity is definitely top of mind. But we want everyone to feel challenged in their roles. We want you to feel supported, and we definitely have a lot of those resources, check-ins and through HR as well to help support new folks.
Awesome. And Monica, could you speak to how you support new employees? I think a lot of times our students are very nervous that they're just going to be put in with patients or on the phones or whatever, and just kind of like thrown in. So what are some ways that they'll be supported?
Yeah, we have a really robust orientation process. And what I tell new employees is it's not defined, not to you. So we certainly have defined it in our heads. It should be about 16 to 24 weeks, depending on what department you're going to. But we've had plenty of conversations at week 14 saying you're not ready. You know that you aren't ready, and we know that you aren't ready. Let's figure out what those things are to get you ready. We want you to be successful. There's no reason to invest 16 weeks into you and not continue investing. So that is what we do. We certainly have a goal, but it's a movable goal. What I think is most important is that students are being honest about how they're feeling during their precepting. If it isn't working, don't say that on the 16th week. You should be saying that on the 4th week. If your preceptor isn't working for you, if the personalities aren't working, if it just, the times, anything, communicate that. You should be sharing regularly. I tell my team all the time, it is our responsibility as leaders to ensure that you are successful. That is not your responsibility when you're in orientation. That's ours, actually. It rests with us. And so the only way we can make that happen, though, is if you communicate. So I'm really proud of our orientation program. And then once you're finished with orientation, you're comfortable with your role. We also offer tuition reimbursement for you to move on to your BSN. So I think we do a lot of great things.
Absolutely. We did have a question, and Monica answered it in the chat, but someone had asked, is there like a standard amount of time that you should stay in a role before you seek a promotion or a more advanced position? Do you guys have any thoughts on that? You can just jump in. It might be different from organization.
Yeah, I think Monica, hit the nail on the head there. It's when you're ready, and ready is different for everyone. You could be ready after 6 months. You've really just, jumped right in, learning all of the things. But I would say it's having a conversation, and to your point, investigate those things, learn more about those other opportunities, because you may be, mindset, you're 100% sold on, I want to be a manager, and you haven't really explored that. And next thing you know, it's not really what you want to do. So learn more about those roles. Take time to shadow and talk to other people in different departments, because you may find something that you didn't realize was a passion for you. And the next thing you know, that's where you're really thriving. So I would say take the time to explore, learn about different avenues and areas of the business that may be of interest, and don't feel rushed. Yeah, take the time to get there.
Absolutely. And I think that's great advice too. It's definitely going to be different for each person. And so I want to be mindful of time. We're kind of out of time here. So my last final question is if you could give just one piece of advice, like leave them with one piece of your expertise and wisdom here, what advice would you give to our students? And I'll start with Macy.
Don't be discouraged if the dream job you applied to turns you down. Take it as, as like a learning experience. Maybe you need to get experience somewhere else and then come back. That only means you're going to be better and more confident in your job. So that's what I would say.
Absolutely. And Monica, what about you?
I'm absolutely biased, but nursing is the best career ever in life. It is not an individualized sport. It's a team sport. It requires your peers. And so now's the time to start that teamwork. Use every resource available to you. And I do mean every single one of them. I tell a story about how I thought when I started nursing school at Columbus State that I didn't need any of that. I remember going to like a session where they were telling you they can help you. And I was like, I'm so good. I'm totally good. I don't need any of that. I learned that I needed that. And so all of the resources that you're thinking to yourself you don't need right now, use them anyway, because that's part of the team. It's part of learning that it is not an individualized sport. You require others to be successful in nursing.
Absolutely. And Brandy, if you have one last piece of advice for our students.
Yeah, I mean, everything that was said, of course, and being prepared. Be humble. I would say, you don't know everything, of course, no one does. And be open to the things that we're talking about, take the advice that you're getting back, be open to feedback. And I would also say be excited. When I'm talking to someone, I want to hear that they actually want to come here, that they're excited to talk to me today. Just this morning, I spoke to someone, I was like, hey, is this still a good time for our phone interview? And they're like, yep. Come on, give me a little something there. I just need a little something exciting. But yeah, I would say, be excited about the opportunities that you're discussing and show that interest.
Awesome. Well, I just want to say thank you to all three of you for spending an hour with us and sharing all of your expertise. I feel like we had a good representation here of a variety of different perspectives in healthcare. And so students, I will say, I will follow up to your student emails with some resources. We have a YouTube playlist of career exploration in healthcare, and I will add this video to it. So that will be on there. And it looks like Monica and Brandy are sharing how you can connect with them. So remember, we all agreed we're going and making our LinkedIn profiles so we can build our network. It looks like Macy's typing here. So yes, you can find all three of our wonderful panelists on LinkedIn, and it sounds like they'll be happy to connect with you. And yeah, thank you all so much for being here, and I hope you have a good rest of your day. Thank you so much.